Exercise is of course important, but
What other steps can you take to avoid knee surgery? Let's ask one of the best surgeons in Turkey.
if a patient gets a knee cartilage problem, is about the patient's genetics. So, of course, inheritance is a thing that we cannot control. If a patient has a family history about a cartilage problem, so this patient tends to have a cartilage problem more than a regular people. So the most important thing is that. But something gets is easier to have the patient have a cartilage problem. So of course obesity is the biggest problem. So to give a weight, we'll lose the weight over the joints, so it will decrease the ratio of getting a knee cartilage problem. The second thing may be about the feeding. Feeding with antioxidant-rich products will also protect the patient from the arthrosis. And also water is the most important thing about the cartilage, because cartilage is made of fluid more than cells, so taking fluid regularly. And of course, smoking is also damaging the cartilage. It's very important. Most of the patients ask us to move or not to move. The best way is the mid way, so not too much. We shouldn't force our ligaments and our cartilage much, but also we shouldn't live an immobile life. So we should get a balance. These are small advices to protect the disease. If a patient comes to us with a pain, first of all, we should understand the reason of the pain. Of course, not every patient needs to have an implant surgery, arthroplasty surgery. Arthroplasty surgery, as I tell to my every patient, is a coverage surgery. We cover the joint. So who needs to have an arthroplasty surgery? Who does not? We should evaluate the patient and understand the problem, why the knee pains, because it doesn't get pain only from the cartilage. There are lots of tissues there. So we should understand the problem. After that, we will decide if the patient needs implant surgery or not. The movement, as I told you, is very important to avoiding or to making slower arthritis process. But to force it too much is also give us some problems. So as I told you before, we should be balanced. Also, the body is very important. Everybody's shape, everybody's biomechanics is different. The best exercise for a man should be arranged according to the structure of the patient. You should understand that our joints share the body forces with our muscles. If we have strong muscles, then during the movement, during our daily life, our muscles protects and share the force with the joint. If we have a little bit weak muscles, then joints have much forces than a strong muscle.
Whether you're trying to avoid surgery or recover from it, the right care changes everything. And when that care earns recognition on national news, you know you're in good hands.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.